In this video, we're going to be discussing, can I start exercising while my Achilles is still swollen? We're going to be exploring the reasons why your Achilles may appear to be swollen or a different shape or size, and what that might mean depending on what type of Achilles injury you've had. My name's Ali, I'm one of the physios from treatmyachilles.com. We're an online physiotherapy virtual service helping people rehabilitate all different types of Achilles injuries. These could be tears, ruptures, you could have had surgery, or you may be experiencing something called an Achilles tendinopathy, which can also be known as a tendonitis or tendinosis. If you would like to find a little bit more about our service, or if you would like to book an appointment, please see the information below. So we have a common question that we are asked, or again has been put into a Google search, and that is, can I exercise with a swollen Achilles tendon? Well, this really depends on why your Achilles tendon is swollen, and there are three main reasons why people report this symptom. The first one is after an Achilles tendonitis, tendinopathy or tendinosis, and we're going to explore why actually that isn't really swelling, it's a change in the Achilles tendon. The second reason could be because you've torn it or you've had a partial rupture. And the third reason could be that you've just had surgery on your Achilles tendon. So we're going to look through each of those different categories and discuss what exercise you could do at that time, or what you might like to consider. So if we're going to be talking about, can I exercise with a swollen tendon due to an Achilles tendinopathy or tendonitis or tendinosis, we need to really work out, is it actually swollen? And although it may appear swollen and feel quite different to the other side, so it can indeed feel quite a lot thicker or bigger or something like that, it's not actually true swelling. To find out a little bit more in more detail about this, there is a wonderful video by Mareka about why I have a lump in my Achilles tendon. The link is below. A quick summary of that is that it's actually a structural change in very few of the fibres within your Achilles tendon that makes that appearance of something being a bit swollen or enlarged. So if your Achilles tendon is made up of lots and lots of bundles of collagen fibres all lined up next to each other in lots and lots of different bundles, we know that with an Achilles tendinopathy it affects very few of those fibres. If we zoom in on those fibres, if your Achilles tendon has been a problem for a little while now, you will notice that there's been a change if we were to look under a microscope or an ultrasound scan. If we were to look, we would notice that those collagen fibres may not be so easily aligned up next to each other, and there may be an increase in some of the fluid that's found in between the two. There can also be an ingrowth of blood vessels or nerve endings into this gap, because this gap is bigger now when we are comparing it to normal healthy collagen fibres. So that can then change the structure of your tendon, creating a lump or a bump. But that lump or that bump can get better, and that can get better by doing the right exercises for your Achilles tendon. And this is where gaining advice from a rehab professional is really important. It's about learning how to load your Achilles tendon the right way. So what I mean by load is the amount of activity that you are doing through your Achilles, and that includes sports, it includes work, and it will also include rehab exercises. So if we can have a look at adapting sometimes some of the things that you're doing, either with work if that's possible, but with training or sports and exercises to help calm that Achilles tendon down and become less irritable and angry, that's one component. And the second option then is actually having a look at that structure and those collagen fibres and the calf muscles that attach to that tendon, and making them more robust and happy to cope with all of the activities and load that you need it to do. Now, this is different for everybody. Everybody starts at a different position of how strong they are, how flexible they are, what their daily life demands are, what their sporting activities are, what their general health is or their gender. And it also then changes because people have different goals. You may love walking your dog, you may love playing golf, you might like running out ultra marathons or playing basketball or being a long jumper, and therefore our different rehab needs to change on that person. And the skill with us at treatmyachilles.com is to assess you properly and find out where you are and where we can find the ability of how strong you are now and how we can progress that on to make those Achilles tendons more robust. And that's when we start to notice a difference in the swelling. So can you exercise with a swollen tendon? It's all about looking at something we call relative rest. So it's looking at what your tendon feels like in the moment and also what it feels like over a 24-hour period after that activity. A good guide is to look at the pain levels of 0, 1, 2 and maybe 3, and we've got a good video based on how to gauge your exercise regime on that, and again the link is below. If you, in a nutshell, keep your exercise between 0, 1, 2 or 3 during the activity and especially over the 24 hours after, including first thing in the morning when you put your foot to the floor if you feel any stiffness or tightness there, then you are at the right level for that Achilles at the moment, but you then will need to do some rehabilitation exercises to help progress and be able to do more. Now the other two types, so a tear, a partial rupture, or if you've had a rupture and then had surgery, this does create swelling. So swelling, like with anything, if you have torn a soft tissue, so let's imagine all of our fibres are going in a nice line and then we have a tear, be it a small tear or a larger tear, what we've done there is disrupt those fibres and then they start to bleed and they cause an inflammatory response, and that's what that swelling is. If you have a repair or surgery, it is really common, again, wherever it is in your body, to get that inflammatory response after surgery and some swelling as your body then starts to recuperate and help heal. So this type of swelling is very different, and depending on the severity of your tear or what you've had done with your surgery may depend on then what exercise you can do. And normally there are protocols related to this. So it talks to us about how long you are from when you had the incident or surgery to how many days or weeks you are after that event now. So we then know what's happened with that tendon and where you are on that healing process, if everything is going according to plan and you have had the right advice. When we're at that point, we then know what exercises we can start to test with you and go through and work through this graded progressive program to get your Achilles back to your normal strength and ability, and also to then progress you back into the sports and activities that you need to do. So this is something that needs to be very carefully monitored. It's something that needs to follow the healing pattern, and it would tend to be led by a consultant if you're seeing one of those, or a sports and exercise medicine doctor or your surgeon. They tend to have protocols to follow. We have our own protocols at treatmyachilles.com that are used with evidence-based, so we know what we're doing is current literature, and it matches the current literature, and we can help you progress and move on. So I wouldn't just start some Achilles exercises or calf exercises specific to that area without gaining advice from a professional. But during this time, your swelling may last a few weeks, it may even last several months, but again it will decrease and go away as your body heals and improves. In that time you may not be doing all of the same sorts of sports that you were doing before, but you could cross train. So what I mean by that is training whilst offloading that Achilles tendon and calf area, and there is a great video on different types of cross training that I think myself and Steph have done in the past that you can see links to below. So when we're looking at cross training, some ideas could be swimming without pushing off from a wall, it could be cycling, it could be using an elliptical trainer, it may be doing workouts for upper body and the rest of your body that aren't included in this. So even at quite an early stage of the recovery process with tears or partial ruptures or surgery, we can start doing some activity, and that is specific to that Achilles and that calf muscle, but also for the rest of your body. And the real benefit of moving the rest of the body and strengthening it is not only that you're ready to go when your Achilles is a little bit or down the healing process, but it also helps with that because it gets your circulation going. And if it's getting your circulation going, it's flushing away things that may have been irritated or inflamed in that area and bringing with it new circulation. So in fact, actually it can help the swelling. It's all about pitching that exercise at the right level. So that's where we would need to again monitor those pain symptoms and any changes in that swelling during that activity and for 24 hours after. So it's always worth gaining some advice on that. In our summary, there are a few different reasons why your Achilles may be swollen. One is that it's not really true swelling when we're talking about a tendonitis, a tendinopathy or a tendinosis, and that's where finding the right rehab exercise at any stage of this process of when it looks quite swollen can be, and that is then moving that through progressively so then you can start to improve that look of that Achilles tendon so it doesn't look so swollen anymore. The second is when we look at tears or ruptures or surgery, and that's where we might look for more cross-training in that moment to help with increasing the circulation, but also specific exercises for that Achilles and that calf related to where you are in that healing process, and protocols that could be either from us or from your consultant.